Lisa Lapointe is BC's chief coroner. She's in Victoria. Thank you very much for joining us.
Well, thank you for having me, Ian. Appreciate it.
When it comes to drug deaths in BC, I think a lot of people picture the downtown east side. In reality, where are the deaths occurring and who's dying?
Certainly the downtown east side is the image that most people see. But what our data shows us for 2022 and 4 years previously, in fact, less than 14% of the deaths in our province happen in the downtown east side. And although that is a vulnerable community, more than 86% of the deaths that occur happen in neighborhoods across the province. There's no area of the province untouched by this crisis, and most people are dying in their private residences alone.
I know as chief coroner, you have studied this a lot. You want to see the number of deaths be reduced. So let me ask you directly, what's it going to take in British Columbia to turn this around?
Well, we've held 2 death review panels into this crisis, and the subject matter experts of our panels have told us loud and clear that the distribution of safer supply is imperative to reduce the death. People are reliant on a toxic, unregulated market that is volatile. The black market for drugs is profit-driven, and people are dying because the drugs that they take are not safe. So safer supply is a means of exchanging the toxic drug supply for a prescribed drug. Currently, it's only a prescriber model that people who are dependent on drugs can use to maintain their safety and help to support them to wellness.
You know, there's some people for ideological or political reasons are very reluctant to support the idea of safer drugs being distributed. And they say what we really need is easier, quicker access to drug rehab and mental health support. What would you say to them?
Yes, absolutely. So what our death review panels have said, this is not an either or. This is a continuum of care. So safer supply is essential to keep people alive. There are over 100,000 people in our province with substance use disorder. Yes, treatment, absolutely, when and where people need it. But people who, frankly, dead people can't access treatment. So safer supply will keep people alive until we can stand up enough treatment for, imagine, 100,000 people. And we also need to know that the treatment is evidence-based. Right now, there are no standards for treatment and recovery, nor are there any regulations for reporting. So we actually don't know which treatment and recovery services are most effective, and that's a big gap.
Well, as this crisis continues, I know we'll speak again about it, and we really appreciate you joining us this evening. Lisa Lapointe is BC's chief coroner. Thank you.